You know how everyone's always telling us to like take a deep breath to calm down? Well, get this. What if I told you the way you breathe
Okay.
could actually be impacting your health
Yeah.
in ways you've never even thought about?
Okay.
We're talking about mouth breathing.
It's not something most people think about.
Exactly. And you sent us a bunch of articles on this, wanting to know
Right.
if
All right.
it's really a
Yeah.
big deal.
Yeah.
So today, we're doing a deep dive into why nose breathing
Yeah.
is so great, what happens when we default to mouth breathing, and what we can do about it. Now, I'll admit, some of the stuff I read is kind of alarming.
Yeah.
Tooth decay, facial structure changes.
Right.
Like, that's got my attention.
I get it. We're talking about chronic mouth breathing.
Chronic meaning.
So if you're breathing through your mouth even when you're not sick,
Okay.
like if you don't have a stuffy nose or if you're
Right.
just like, sitting around,
Right.
that's when it's a problem.
Got it.
Yeah.
And one of the articles mentioned blocked airways as a major culprit, right?
Mm-hmm.
So it's like trying to use a straw that's been pinched, almost closed,
Yeah.
but for air and with our lungs.
It's a great way to think about it. Your nose is designed. It's
Crazy.
really quite incredible to be this air conditioner, filter, and humidifier.
Wow.
It does all those things before the air even reaches your lungs.
Huh.
Mouth breathing bypasses all of that.
And when we bypass that system, then what?
Well, a number of things. Think about it, dry mouth, for one.
Oh, right. Makes sense. Yeah.
Your mouth isn't designed to humidify all that air. And you mentioned tooth decay.
Right.
Well, without saliva constantly rinsing your teeth, you're more prone to cavities.
Okay. Yeah, that makes sense. What about some of the other less obvious consequences? One article mentioned abnormal facial development,
Right.
especially in children.
Mm-hmm.
That seems like a huge deal.
Well, it can be, but it's not as simple as like one day of mouth breathing and you wake up with a different face, right?
Right.
When your mouth is constantly open, your jaw hangs down and your tongue rests low in your mouth.
Okay.
Over time, this posture can actually influence the way your facial bones grow,
Ah.
particularly in children because their facial structures are still developing.
So you're saying mouth breathing can literally impact how your face forms?
In a way, yes. And it can even impact your speech.
Really?
Because think about it, your tongue plays a crucial role in how you form words, right?
Right.
If it's constantly in the wrong position because of mouth breathing, it can lead to difficulties with pronunciation, particularly with certain sounds.
Interesting. It's crazy how interconnected everything is. Like our breathing and our face structure and even like how we talk. This is way more than just having bad breath, huh?
It really is. And we haven't even gotten to how it can impact our sleep.
Oh, right.
Yeah, mouth breathing can really mess with your sleep. Like you don't get as much oxygen. And it can even be a factor in sleep disorders like snoring and sleep apnea.
Okay, now I'm thinking about how I breathe when I sleep, and it's freaking me out a little bit.
Yeah.
But before we go too far down that road, let's talk about what you can do if you think you might be breathing through your mouth too much.
Well, the first thing is to figure out why it's happening in the first place.
Right.
It's like if you hear a weird sound in your car, you wouldn't just ignore it, right?
Definitely not. You'd want to get it checked out and figure out what's going on.
Exactly. You need to go to a professional, a doctor, a dentist, or maybe an ear, nose, and throat specialist, an ENT.
Right.
They can help you figure out the root cause. It could be a bunch of different things, like maybe you have allergies or nasal polyps or a deviated septum.
The deviated septum, what's that again?
That's when the wall between your nostrils is crooked,
Oh, right.
and that makes it harder to breathe.
So that makes sense.
The good news is that once you know what's causing it, there are treatments. For some people, it might be as simple as using a nasal spray for their allergies. Others might need an orthodontic appliance.
Orthodontic appliances. Like what?
It depends on the person and what the issue is. Sometimes it's a retainer type thing that you wear at night, and it kind of helps your jaw to develop in the right way. Other times it might be expanders to widen the palate, which can help you breathe better through your nose.
Interesting. So like a bunch of different approaches depending on what's going on. One of the articles even mentioned surgery.
Yeah, but surgery is usually only for more serious cases, like if someone has a really badly deviated septum that's blocking their airway. And even then, they've got much better surgical techniques now, so it's not as invasive as it used to be, and the recovery is easier.
That's good to know. But it seems like it would be better to catch it early on, if you can, before it gets to that point.
Yeah, absolutely. Early intervention is key, especially for kids. But even if you're an adult, it's never too late to make changes. One of the articles even talked about practicing nose breathing.
Yeah, I was curious about that. Do we really need to do exercises for our nose?
It does sound a little strange, but it can really make a difference. It's like you're teaching your body to breathe the way it should be breathing.
Okay, I'm listening. How do you actually practice nose breathing?
It can be as simple as just paying more attention to your breath throughout the day.
Hmm.
Notice if you're breathing through your mouth and then gently switch back to your nose. There are also some specific exercises you can do. And yoga and meditation also incorporate a lot of mindful breathing practices.
Interesting. It's like we forget how to breathe or something.
It's true, we do kind of go on autopilot.
Yeah. And this deep dive has been really eye-opening. It's not just about having bad breath or snoring or whatever.
Right.
We're talking about things that can affect our sleep, our teeth, even how our faces grow. It's kind of a lot to think about.
It really is. It's often a symptom of something else going on, and it can impact our health and well-being in all these ways.
But the good news is we can do something about it.
Exactly.
Whether it's talking to a doctor or a dentist or just being more aware of how we breathe.
Exactly. If anything from our deep dive today made you think twice about this, you might want to bring it up with your doctor.
That's really good advice.
Yeah.
You know, it makes me wonder if changing how we breathe can have this much of an impact. Maybe we should be paying more attention to our breath in other areas of our lives, too. Like, could it help us focus or stress less or even just improve our mood?
There you go. That's something to think about.
Right. Maybe we all need to take a second, breathe in through our noses, breathe out slowly, and just think about how powerful that is.
I love it.
Yeah. It's been fascinating to learn so much about mouth breathing.
Mhm.
We'll see you next time when we do another deep dive into something interesting from the world of science.